I mean, do we really know what diabetes is? I mean, it's about sugars, but what else? Who cares? I care. Hi, I'm Dr. Williams of Gateway Direct Health, and I hate diabetes. Not the patients, but diabetes. To me, it's one of the worst diseases ever, but it's so common, unfortunately, and so many people suffer from it every day. Surprising statistics, a little over 1 in 10 people have diabetes. And diabetes is considered a preventable disease. So let's get into it. Diabetes has something to do with some kind of hormone called insulin. Insulin regulates the amount of sugar in our blood. It is released when there's a lot of sugar or we need to conserve sugar, and so it moves it from the blood into the cells, which then turns it into fat, which is stored sugar. Now, when insulin can't do its job, this is when we have a problem. So in patients with type 1 diabetes, their pancreas, which is a gland in the abdomen, no longer produces insulin. It just can't. And so where is the sugar going to be that they consume? High levels in the blood. It cannot get to the cells. And so patients with type 1 diabetes need insulin. That's right. They do have to inject themselves multiple times a day in order to get insulin to move the blood from to move the sugar from the blood into the cells. Now, with type 2 diabetics, they are making insulin. The pancreas is making insulin. However, insulin is not working. So effectively, it looks like there's no insulin in the blood. And it's not working for a multitude of reasons, including the sugar level itself, right? Like even sugar, then kind of like a positive loop affects insulin and its ability to work, which then increases more sugar and then it affects insulin, so on and so forth. And so patients with type 2 diabetes have insulin, it's just not working to move the sugar into the blood. Now, here's why I hate diabetes. High sugar is toxic. We talk about toxic relationships and toxic work environments. Sugar be toxic, especially at high levels. And it affects every single part of the body. Yes, even your hair, your brain, your eyes, your stomach, your heart, your kidneys. You know what? Let me just go ahead and list the diseases that, that it's associated with. Thinning of your hair. Let's talk about stroke, right? Having kind of a blockage of the brain, which is what causes a stroke. Blindness. A lot of people get cataracts and blindness, glaucoma, and some other eye issues from diabetes. Even your stomach. Some people develop what we call gastroparesis. Paresis means paralysis, gastro, stomach. So paralysis of the stomach because the nerves are not able to help the stomach to move the food from the stomach into the intestines. And so the food stays there. The stomach does not like to be distended. It does not like food in there for prolonged periods of time. And so guess what it makes the body do? Throw it back up? Sure does. And so people get really bad abdominal pain, nausea, vomiting, and have difficulty from gastroparesis. It also, diabetes also affects the kidneys. Have you heard of dialysis, guys? Where a machine replaces your kidneys' abilities to filter the blood? I mean, do I have to go on? Yes, I do. What else does it affect? Diabetes affects your limbs, especially your feet, okay? Diabetes affects your arteries, which are the blood vessels that take blood from the heart to your organs. And so if it's causing blockages in your arteries, then the blood is not getting to your legs. Then guess what happens? The leg basically dies a slow death. Sometimes it's more expedited than slow. And so that's how people get amputations. Yes, guys. Guess how else they can get amputations? Not just from the diabetes affecting the arteries, diabetes affecting the nerves. Okay, let's talk about nerve damage. Remember how I said gastroparesis is paralysis of the stomach because of the nerves? That can happen in your legs. And some people get numbness and tingling sensations of their feet and legs, and even hands that goes up the arms, go up the legs. But guess what that also kind of causes? You not to be able to feel if you have a wound or if you step on something. Guess what that causes? Infection of the feet of your wound because you don't know it's there. Guess what that's also going to, it's just a whole cascade, guys. Okay, the infection then can affect the whole body and can erode basically your feet, your legs, and therefore develop amputations, huh? The death of your limbs, the death of your toes. Yes, I know what I'm saying is gory. I apologize. But also, these are reasons why I hate diabetes. Okay, head to toe. It's an awful disease and it is preventable, guys. So I'm on a mission, huh? The Lord has put me on a life mission. The Lord has put me on a life mission to tell others about diabetes, to explain it at a level that people can understand, and hopefully instill the fear of God from them getting it. Just kidding. But hopefully shed some light on why the doctors are really big on prevention of diabetes, treatment of diabetes. I understand we be pushing insulin, we be pushing medications. Okay, yes, I'm with you on that. That is tiring because you're like, I don't want to be on medications, right? Or I don't want to stick my stuff every day. I understand. I get that, right? Having to, one, stick yourself just to check your sugars is annoying, but then two, have to stick yourself to give yourself insulin. Yes, I understand. Now, let's talk about how we can avoid medications. Wouldn't that be awesome? So that will be the next YouTube video. We're going to talk about how to get off diabetes medications or not even get on it at all, because you out here making sure your body is nice and healthy. Your sugar levels are excellent. We'll even go into what the normal sugar levels should be. And then we'll talk about the different types of treatment for diabetes, including my favorite, insulin. I'm just kidding. It's not my favorite, but it's vital, right? Like, again, for type 1 diabetics, it's very vital. For type 2, we got other options. We got stuff that we can try. And again, probably don't even need medications, but we do have some work to do. We do have to figure out how we can do that. And I will explain that in the next video. If you're enjoying this content, please like. If you're enjoying this content, please like, share, comment, and subscribe. And let's get out some content every week. This week we're talking about diabetes. Next week we'll go more into it. And then how about you comment below what other topics you want me to discuss? Thank you guys for your time, and I'll see you next time.